maybe a couple exciting other fronts. One was looking at database, big data. And so Sergio Baronzini won a big award, and he gave a presentation about the Spoke database. And so the Spoke database is a database of databases with 40 million items, including genetics, and 100 million in relationships between these different nodes of information. And they were able to take patients from University of California, San Francisco, UCSF, patient database, and make almost like a barcode of information about individual patients, and then compare them with the Spoke database. And they were able to predict who was going to get multiple sclerosis 3 years before they actually got the disease. Based on genetics, based on going to the hospital for what we call the MS prodrome, symptoms prior to developing MS, and it was 83% accurate. So I found that very fascinating. Big data and using AI to understand that information and potentially diagnose people sooner. The other area that I am very interested in is remyelination. So can we repair the damage that's been done? And there's been a new way of screening patients, probably a better way of screening new compounds for potential remyelination. And that was using a 3D printer to make artificial axons. So this group was able to make 1 micron artificial axons, and then put oligoprogenitor cells on it, and then apply different compounds to see if it allows those oligos to grow, to remyelinate. And a couple companies, one had a poster and one had a platform presentation talking about some preclinical compounds that seem to cause robust remyelination. So I'm anxious to get those medications into the clinic to see if I can help repair the damage that's been done in people with multiple sclerosis.